So now we're going to do the musculoskeletal assessment. And so the first thing is I'm going to assess her alignment of her spine. And so I'm going to have her slightly bend forward. And I'm going to palpate down her spine column to see if it is straight and that she has the lumbar concavity. And so I would say that she is erect with proper spinal alignment with lumbar concavity. Now, can you get into bed for me, please? And so the next part of musculoskeletal is the joints. And so we're going to be inspecting the joints for any redness or pain or swelling that they may have and any crepitation. So I'm going to be putting her through range of motion exercises, and as I'm doing that, I'm feeling for any crepitation, and I'm also asking her for any, if she's having any pain during that time. I'm going to remove her socks and shoes so that when we get to those joints, we can assess them appropriately. So starting with the head or the neck, I would do, and I put my hand, usually they're laying flat, but for this video I'm going to show you like this. My hand's behind her head, my other hand is under her chin but not poking on the soft tissue. And I want to do flexion and extension. Flexion and extension. And if I was doing range of motion exercises, I would do each exercise 5 times, but for purposes of this video I'm just going to show it a couple of times. And then we do rotation. And then lateral flexion, I'm trying to touch her ear to her shoulder. And again, I would do each exercise 5 times. And I did not feel any crepitation in her neck. Then I'm going to go to her shoulder. And for her shoulder, the first exercise I'm going to do, I'm going to support the other joints, is flexion and extension. So let's go straight up and straight down. I'm going to do that 5 times. And I would do both sides of the body, but for the purposes of this video, I'm just going to do this side. And then I want to do what they call abduction and adduction. So in adduction, you're adding to the body. And so for the shoulder, I want to add and try to have her hand touch her other shoulder. And then away or abducted. And I want to go all the way around. So I get full range of motion of this shoulder. And then the last one on the shoulder is what we call the scarecrow. So you bend their arm, it's like a 90 degree. And then you do external rotation, internal rotation, and that is of the shoulder. Next, we'll move to the elbow, and the elbow would have flexion and extension. We do it 5 times. And then the other exercise on the elbow, we call it supination and pronation. So in supination, it's like you're holding a bowl of soup. In pronation, you turn it back toward the bed. And you would do that 5 times each. And now you can move to the wrist. And with the wrist, we have flexion and extension, hyperextension. And then we have radial deviation, ulnar deviation. And then with the fingers, I want all the fingers, every joint, to have flexion, and then every joint to have extension. And then we do ab and adduction of each finger. So add and ab. And then I can move to the thumb. And with the thumb, we did flexion, extension. And then we have an exercise called opposition. And in opposition, the thumb needs to cross all the way over and touch at the base of each finger. And I would do each one 5 times. And so I did that one 5 times, that one 5 times, and that one 5 times. Okay? And that's all on the hand and fingers. Then I'm going to move to the hip. And if you have the patient do flexion, extension of the hip and their leg is straight, it's much more difficult to get full range of motion. So I'm actually going to lower her head so that I can get full range of motion of the joint as far as I can. And so because it is difficult for a patient to raise their leg, just a straight-legged raise, we're going to combine the hip with the knee with flexion extension. So I'm going to bend her knee and do flexion of both those joints and extension of both those joints. Okay? And so another exercise for the hip is again the abduction and the adduction. So ab, away, and I want to go as far as the patient can go. And then when I add it back to the body, I want to try to cross over midline if the patient can do that. And then the last one on the hip is internal rotation and external rotation. Okay? We already did the knee with the extension, flexion extension. So now I'll go to the ankle. And so I want to do dorsal flexion and plantar flexion. And then internal, external. And then with the toes, again, I want to do flexion of each joint and extension, and then the abduction, adduction of each toe. And so now you've done your range of motion, you've assessed all of your joints for the redness, the swelling, the pain, crepitation, and you've done both sides of the body. So now that will be the end of the musculoskeletal.